And then long-term damage from blood clots. I mentioned that many patients will not have any long-term damage. They recover completely, but some people will have significant symptoms or less symptoms. This patient has significant right leg swelling, dark pigmentation, dry skin, itchy skin. That's called the post-thrombotic syndrome, also called venous insufficiency, sometimes referred to as post-phlebitic syndrome. Symptoms are chronic swelling, chronic pain, a pressure sensation, a heaviness, a tightness, a leg tiredness. The skin may get firm, be itchy, be dry, maybe dark pigmentation, visible spider veins. And in the worst case, the skin can break down and lead to skin ulcers. Now, the post-thrombotic syndrome can be prevented with compression stockings, or at least the chance to develop it can be minimized by using compression stockings to be worn shortly after DVT is diagnosed. Once the initial swelling is down, they're called grade 2 stockings. They need to be individually fitted depending on how big the patient's legs are. They have a certain pressure that you see mentioned here, 35 millimeter mercury at the ankle, and they're less so than going up the leg. Individually fitted. The TED stockings that people used to wear and sometimes still do in the hospital to prevent clots are insufficient. They have very little pressure. They do not prevent the post-thrombotic syndrome and do not help with the symptoms of the swelling. They should be worn below the knee if the swelling is below the knee, but if the swelling involves the whole leg, they should be worn above the knee. And they should probably be worn as long as there's leg swelling. Sometimes we hear, and this is based on an old study, that they should be worn for 2 years after the clot. Maybe that's true, but maybe it's not true. I typically advise patients they should wear it as long as they have leg swelling, and if they then take it off for a day and they don't have leg swelling, leave it off for 2 days, no swelling, then I tell them it seems to be appropriate not to continue to wear them. And then a second thing that we should consider before just saying, oh, this is post-thrombotic syndrome, nothing can be done except for stockings. Some people after DVT develop scar tissue, scarring of the vein. It's narrowed, the blood doesn't flow right. And if that's present, the radiologist or vascular surgeon can put a balloon in, balloon it open, maybe keep it open with a stent and drain the leg better. So that should be considered, and it often is not. So what do we do to figure out? In this area here, in the pelvis, we cannot see anything with a Doppler ultrasound. This one is limited to the legs. But it's still helpful to know how the leg looks down here. If it's completely open here, and the leg is significantly swollen, then we suspect there may be narrowing up here. Then we obtain an MRI, which is an MRI venogram, or a CT venogram of the pelvis, and that demonstrates where the narrowing is present. And then we can refer the patient to vascular radiology or vascular surgery for the balloon angioplasty and or stenting. Then if nothing can be done with that procedure, sometimes patients benefit from a lymphedema pump. There are a number of air sleeves, lymphedema pumps on the market, and they can give the patient significant relief.